Why should you do exercises for scoliosis? Scoliosis does cause the spine to bend and twist unnaturally, but people with scoliosis can still exercise. There was once a time when the place of exercise was questioned in scoliosis treatment. However, these days, exercise-based approaches to treating scoliosis are much more accepted. There was also a time that it was thought that scoliosis patients had to be completely sedentary, meaning they couldn't perform exercises and they had to be scared. In fact, we know now that people with scoliosis can not only survive the exercises, but they can thrive. In fact, there are many professional athletes that actually have scoliosis and they perform at a very, very high level. There was also one time that we thought that people that with scoliosis could perform a specific sport, and if they did this sport, it would cure their scoliosis. And what I can think of is like swimming. Like patients were told just to swim and they would cure them from scoliosis. We also know that's also untrue, that you can't just do a general sport or activity and it can cure your scoliosis. Now, we know scoliosis is typically diagnosed through a combination of physical examination and x-rays. Being diagnosed with scoliosis means that the diagnosis of scoliosis is a progressive condition. And unfortunately, it's its very nature to get worse over time. The progression of scoliosis means that the size of the unnatural curvature is getting bigger. And it's getting bigger, it means the effects that the scoliosis is causing is also getting bigger with it. These can be also postural changes, it can be pain, it can be asymmetry, it can be coordination, but whatever the scoliosis is affecting in you, which is unique to you, is normally going to get worse as your curve gets worse. And when we look at exercises and patients with scoliosis, first thing I want to tell you is that no exercise should be performed without having it cleared by your treatment provider. Meaning, if you're treating somebody with your scoliosis, definitely check in with them to make sure that the curve that you have will respond to these exercises. But exercises can help with patients with scoliosis in many different ways. One thing it can help with is in pain relief. We know patients that experience pain, when they exercises, that they can focus on increasing spinal flexibility, and specifically, it can provide pain relief and flexibility. And this can make curves less rigid. Curves, as they progress, to become more rigid, and this increasing spinal rigidity can lead to pain. So therefore, if we can make curves more flexible, we can potentially decrease pain. We know scoliosis isn't painful for everyone, but it's more likely to become painful in the adult stage when scoliosis is compressive. And as it compresses over time, pain is definitely a more common effect. In fact, in adult patients, pain is the number one reason why they get a diagnosis of scoliosis and they seek treatment. However, it's not just clearly understood how fast a curve will worsen in the adult form, but it is affected that it can cause pain not only to the surrounding tissues, but also the surrounding muscles. We also know that scoliosis can introduce a lot of uneven forces to the spine. And when it does this, it can affect the entire body. And when we look at scoliosis pain, it can not only be pain because of the joints being out of alignment, but it can be because of the muscles that are also stiff and sore, or more likely unbalanced. They're working in an asymmetrical manner. Now, some of this is by need, because if you have an asymmetrical curvature, you're going to have asymmetrical muscle contracture to deal with the asymmetrical weight bearing. But some of this can become more chronic and become painful as a result of it, because some of them become overused and they become excessively tired, or they don't deal with endurance issues very well, meaning long periods of standing or sitting can lead to pain. Scoliosis-specific exercises and physical therapy can help address these weak and unbalanced muscles to help them become more symmetrical. But there's one thing that every scoliosis patient understand: there's never an ability to gain perfect symmetry. Your spine would have to be zero or perfectly straight to gain perfect symmetry. But by improving the strength of the surrounding muscle tone, we can help provide optimal support and stability, which can help decrease pain. We also know exercises can help keep the spine muscles balanced and supportive, taking more pressure, hopefully, off the spine, but more likely dealing with the endurance problem, like I mentioned. We also know exercises can help patients with treatment of their scoliosis specifically. Now, general exercises like swimming or weightlifting, it doesn't have a corrective effect on scoliosis, but there are something called scoliosis-specific exercises that potentially could have a corrective effect especially when they're combined with other facets of scoliosis treatment like therapy, rehabilitation, corrective bracing, and other types of scoliosis types of therapies. The more exercises patients perform, meaning the more fit they are, the healthier their muscles and tissues are, typically the better they can perform these scoliosis exercises. And the more flexible their spine is, the easier it is for them to perform these scoliosis-specific exercises. So therefore, the more general exercises a patient perform typically means the better they are performing scoliosis-specific exercises, meaning the better they would respond to treatment. So therefore, there is benefit just to doing general exercises. Now, the best approach, though, would have your spine evaluated by somebody who prescribes these scoliosis-specific exercises and therapy, and to have a prescription for you to perform these exercises in addition to your general exercises. And not only will they improve your overall strength and mobility, but they can also help address the specific muscular imbalances that are associated with your scoliosis, and to strengthen the muscles that are unused, and to help relax the ones that are tight, and stretch out the ones that are tight, and tighten the ones that are loose. And these scoliosis-specific exercises can improve posture, can activate specific associated muscles to help improve overall body-brain communication. So when we look at scoliosis-specific exercises, they have the most benefit. But patients that perform these scoliosis-specific exercises the best are patients that also perform general exercises the best. So there is definitely a commonality there. So the spine is designed to move and to be flexible and to be strong and to protect the nerves and spinal cord. And the stronger and the more flexible the spine is, typically the better it can respond to treatment. So when we look at exercises, we know that no general exercise alone can correct scoliosis. But if a patient does perform general exercises, they can learn scoliosis-specific exercises more efficiently and perform them better. And this can be a very important part or facet towards non-surgical treatment of scoliosis. Thanks for watching. I hope you found this information helpful. If you have any questions about this topic or other scoliosis questions, type in the comments below and let us know. And finally, subscribe and hit the bell icon to be notified of when we publish new videos just like this.